Perfect. So it looks like we have one patient for the rest of the evening, and they should be arriving any moment now. Perfect. Great. Oh, and hello there. Perfect timing. Welcome to Dream City Clinic. I am Dr. Brain. Are you here for an exam? Perfect. And under what name would this be? Okay, and how do you spell that? Great. Beautiful name, by the way. And what is your birthday? Great. And what sign does that make you? Perfect. Thank you so much. So I think our system is a little bit confused. Are you here for the very detailed and slow cranial nerve exam, or are you here for the fastest cranial nerve exam of your entire life? Option 2, the fastest. Great. And just gonna make sure here, how many minutes would you say you have? As fast as we can make this. Great. But as also as detailed. Understandable. We can do that. We can do that. Great. So what I want you to do first is please take a seat at the doctor chair that's just about half a meter in front of me. It's very cozy. We do have lovely cushions that will help you relax. Good, just sit there and relax. Good, good, good. I just have three questions for you before we begin. Have you felt unwell at all within the past 2 weeks? How are you feeling? Okay, moderate. Okay, have you had any signs of a headache at all in the past 2 weeks? Thank you. And have you fallen at all recently? Or have you slept strange on a pillow where sometimes your neck could feel stuck in certain places? Okay, perfect. That's all we are going to test for the questions today. First, we're just going to begin with some vitals. I want you to sit still. You're going to hear a click, and that's going to get your temperature, okay? 3, 2, 1. Perfect. Looks like your temperature is average. That's great. Next, what I'm going to do is I'm actually going to get your heartbeat very fast for you just to relax. It's going to be just a little bit cold. First, I want you just to breathe in and breathe out. Okay, breathe in. Very good. Other side. Breathe out. Very good. So it does look like all your vitals are doing great so far. So we're going to begin with the more preliminary basic functions of the exam. So first we're going to test the cranial nerves in your eyes. Okay, so I have a pen light here, and what I want you to do is I want you to, with only your eyes, do not move your neck, your shoulders, or your chin at all. Just with your eyes, I want you to follow the light. I'm just going to hold your chin so you don't move it, okay? So just follow the light, follow the light, follow the light. Very good. And in the past 2 weeks, have you had any changes with your vision at all? Okay, have you had any changes with your line of sight? Okay, keep following the light. And as well, are you someone who wears any glasses or contacts? Okay, perfect. Thank you for letting me know. Keep following the light. Only the light. Follow the light. Good. Great. Okay, now I want you to let me know, where do you see the light in your vision? Is the light at the top left or top right? Good. And over here, is the light at the top left or the top right? Okay, and is the light at the bottom left or the bottom right for you? Good. And is the light at the bottom left or the bottom right? Very good. So what I want you to do is I'm going to get very close to your eyes. And where would you say the light is at the brightest? Is it brightest here, or is it brightest there? 1 or 2? Great. Is the light brightest here at 1, or is the light brightest here at 2? 1 or 2? Great. And is the light brightest here at 1, or is it brightest here at 2? 1 or 2? Okay, 1. So it looks like your eyes are functioning great. It looks like your eyes are also dilating with your pupils perfectly, which is exactly what we are looking for. Okay, and what we're going to do now is we're going to use something called a lens test. I have an object here. This is called an optical flip. And what these are is these are different prescriptions in each of these lenses. I want you to let me know what looks better, 1 or 2. Are you ready? Let's begin. I'm going to put them just carefully over your eyes. Now, what looks better, 1 or 2? 1 or 2? 1 or 2? Here's 1 again, or 2. Okay, 1, perfect. Now what looks better now? 1 or 2? 1 or 2? 1 or 2? Here's 1 again, and here's 2. Good. Here's the third option. Let me know what looks better. Here's 1. Here's 2. 1, 2, 1 or 2. And what looks better now? 1 or 2? 1 or 2? 1 or 2? 1. So it looks like with the 0.5, your eyes are seeing better, which is exactly what we expect because these are zoom lenses. That's perfect. So it looks like your eyes are working properly. Okay, we're going to give you So now what I'm going to do is final little eye test. I have a lens changer here. I'm going to put this over your eye. I want you to let me know what you are able to see when I apply the lens. Are you ready? Let's begin. So I'm just going to apply the lens. Now what are you able to see? So everything is red and some of the details are gone. Fabulous. So perfect to say lens, a red lens. Awesome. So what I'm going to show you now is I have a Snellen's chart. Okay, and with this Snellen's chart, I'm going to ask you just to look at it carefully, okay? So I'm going to pull the Snellen's chart up. It's this. It's with the little letters on it, okay? Are you able to see the card? Are you able to see the chart? Okay, I'm going to point at it now. Are you able to tell me what letter that is right there? What letter is that right there? That is N-E. Perfect. We're going to move on to the third line now. Are you able to see the third line? Good from where you are. And can you tell me what is the first letter of the third line? That is an F. Perfect. Now very quickly, what color is this right here? This little rectangle. That is red. And what color is the rectangle next to it? That is green. Perfect. So it looks like your eyes are functioning amazingly. That is fantastic. Good news. So next we're going to test your nose and your sense of taste. So I have 4 essential oils in front of me, and I'm not going to tell you what they are until after I let you know, but I want you to take a guess at what the essential oil is based off of the smell. There's no correct answer, but just the fastest thing that comes to your mind, say what it is. Okay, are you ready? We're going to begin with this one. This one is the most difficult, and we're going to get progressively easier as we go along, and this one is amazing. So I'm just going to put this right under your nose. I want you to take a guess what this one smells like. Perfect. So you're smelling floral. Okay, so kind of like tea. Okay, and it kind of reminds you of some sort of spa. Perfect. So this one is chamomile. It is a floral and it smells exactly like tea. In fact, this is the essential oil that they do add to make chamomile lattes. Exactly. Perfect. Gonna move on to the next one now. So we have this essential oil. Can you tell me what color the bottle is? Orange. Perfect. So what I'm going to ask you to do is give this one a smell. Okay, so this one smells like citrus, like fruit, and exactly like orange. Perfect. So this one actually is orange. You're doing fantastic so far, especially with how fast you are able to respond. Amazing. So we're going to move on to this one now. And can you tell me what color the bottle on this one is? This one is green. Fantastic. So this one, wow, this one is my favorite. So are you able to identify what this one smells like? Okay, a bit like nature, a bit like tea, and very minty. Okay, so what's the guess? Mint. Fabulous. You are the fastest person that's ever able to respond to that one. This one is eucalyptus, otherwise known as mint. It is often used in gum, so that is fantastic. You're doing amazing. And we have one more to go. So this one is the last one. And can you tell me what color the bottle on this one is? This one is purple. Perfect. So I'm going to ask you, are you able to identify this one? Yes, this one smells like, again, like tea, very good, like a spa, but more floral, like a very common flower. Okay, maybe soap. Very good. So what do you think this is? Great. So this one is lavender. You did fantastic. That was spectacular. Amazing job. Truly amazing. That was great. Okay, so now we are going to move along to the taste test. So what I have here is a bottle, and in this bottle we have one of 2 solutions. Either this is going to be very, very sour. It'll make your face do that. Or this is going to be very, very spicy. Okay, and I want you to let me know which one it is. Okay, let's begin. I'm just going to open this up. Okay, I'm going to ask you to say, 3, 2, 1, and 1, drop. Okay, now I want you just to try the taste. Just go. Very good, and what is that? Yes, I did see your face do this. That one is sour. Very good. So it looks like your sense of smell and your sense of taste are correlated, and that tackles 3 of the cranial nerves. That is perfect. What we're going to move on to now is musculature. So what I have here is I have a musculature. It's like a useful musculature tool. What I'm going to do is I'm going to tap on certain parts of your face and your shoulders, and I want you to use those muscles. I want you to also replicate what I do. Okay, so first I want you to raise your eyebrows. I'm going to tap right on your forehead. 3, 2, 1. Very good. And raise your eyebrows. Raise your eyebrows. Good, 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 good. And relax them, relax them. Great. Now what I want you to do is if you were very worried, I want you to furrow your brows. Furrow your brows. Good. I'm gonna tap, 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 tap. Good. Then I'm gonna use the tool here. 3, 2, 1. Good, look at me and relax. Good, looks like you can actually furrow your brows. That's great. What I want you to do is I want you to close your eyes very, very tight and do not allow me to open them. Are you ready? Let's begin. 3, 2, 1, close your eyes. Resist, resist, resist. Very good. Open your eyes, look at me. Good. Okay, look up. Okay, look down. Okay, look over here. Can you look over here? What color is the wall? That's green. What color is the wall over there? That's also green. Good. Look over here. Look over here. Very good. Looks like your eyes are functioning amazingly. Now, what I want you to do is I want you to give me a very cheesy smile with your teeth. Just a very cheesy smile. Okay, I'm going to tap right there. Good, other side, tap right there. Good, now relax the smile. Now can you give me a very sad frown, a very comical frown? Good, I'm going to tap right there. Good, I'm going to tap right there as well. Good, now we're going to move on to your shoulders. Are you able to lift one of your shoulders? Great, I'm just going to tap right there. Good, other shoulder, raise the other one. 3, 2, 1, and raise. Good, so the musculature is working properly now. What I want you to do is I want you to raise your shoulders, and I'm going to press down on your shoulders. I want you to resist, okay? 3, 2, 1, resist me pushing down. Resist, 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 resist. Very, very good. Great, so now what I'm going to do is I'm going to do the last exam, which is the musculature test. I'm going to move and maneuver your neck around, okay? So first I'm going to just tilt your neck one direction. Great, and are you able to hold this way that I placed your head? Good, and let me know how many fingers am I holding up. This is 5, okay, and how many fingers am I holding up now? This is 3, and how many fingers am I holding up now? That is 1, great. Gonna move to the opposite part now. Great, and are you able to keep this the way that you are right now? Good, how many fingers am I holding up now? This is 5, great. How many fingers am I holding up now? This is 4, fantastic. How many fingers am I holding up now? That is 2, good. I'm gonna maneuver right now to the center. Okay, how many fingers am I holding up on this side? 5, okay. How many fingers am I holding up on this side? 1, okay. How many fingers am I holding up on this side now? 1. And how many fingers am I holding up now? 3, perfect. So it does look like your cranial nerves are all functioning 100%. I'm gonna send the report with you back home, and you can actually relax now and go